Hello, my name is Ally Christiani and welcome to Address the Disconnect. Today we're doing part 2 of series 1, covering systemic racism in healthcare. Last episode I dove into the history of this issue, and today we're going to take a look at how it continues to prevail and how COVID-19 has exposed certain socioeconomic factors that contribute to health disparities in America.
When we talk about equity and inclusion, they're not just nice notions. They are an imperative that we must embrace as a city.
In Milwaukee County, Wisconsin, where Black Americans are just 26% of the population, they're more than 70% of the deaths from the coronavirus. The reports are startling in North Carolina, Connecticut, and Michigan, too.
Based on our preliminary data, we see that it appears to be impacting minority populations greater, with 33% of cases and 40% of deaths being in African Americans.
Poor access to adequate health care, unemployment, the wealth gap, education, housing conditions are all byproducts of the poverty cycle. Unsurprisingly, implicit bias is immersed in these determinants, and that is where we begin to understand the horrific realities that Black communities have been facing in the age of COVID-19. The United States makes up 5% of the world's total population, yet they account for a fifth of all COVID-19 fatalities. CDC data revealed African Americans comprise 25% of that number, and therefore are dying at a rate 3.5 times more than white Americans. Considering African Americans make up only 13% of the population, that number is astounding. African Americans pose a greater risk profile for COVID-19. And what that means is that there are certain underlying conditions that are more predominant in those dying from COVID-19. The conditions include hypertension, heart disease, and diabetes. Research has shown that Black people develop these diseases at a greater rate and at a younger age. In a study by the CDC, 90% of the hospitalizations with severe COVID-19 had at least one of these underlying conditions. Stress is related to immunity, and Black people have increased stress in their life. Stressors include income inequality, discrimination, violence, and institutional racism. This type of stress has actually been defined by the medical community with a term called weathering. When it comes to employment and COVID-19, there are two factors to consider. Black people have higher rates of both unemployment and employment in jobs that do not include health insurance in their benefits package. The jobs deemed essential by society in this pandemic disproportionately affect Black people who find themselves on the spectrum of these lower paying jobs, including fast food servers, grocery store clerks, nurses, teachers, and public transportation. These jobs cannot be done remotely and require public interaction. These workers often travel either by carpool or via public transportation, all of which increasing their exposure to the virus. These disparities were already widely known, especially in the counties that are most affected. However, the data explaining how these conditions blend to create these spreading zones in communities of color came very late to the containment of the virus. This delayed data consequently delayed aid, and researchers criticized the federal government for their failure to act appropriately in the communities that needed it the most. Acknowledging the connection between race and economic inequality as a vital explanation for why the virus is attacking Black communities disproportionately will hopefully continue to lead to constructive conversations of racism on a large scale, and therefore policy implementation. Understanding healthcare as a basic human right.